What is a retroverted uterus, and how does it affect the chances of getting pregnant?
Hello there. Today we're going to discuss a topic that affects a significant number of women globally, but is often misunderstood: the retroverted uterus. We'll learn what it is, and importantly, how it may or may not impact your chances of getting pregnant.
What is a retroverted uterus?
A retroverted uterus, also known as a tilted or tipped uterus, is a normal anatomical variation seen in around 20 to 30% of women. In this scenario, the uterus, which is usually positioned straight up and down, or slightly forward, is instead tilted backwards towards the spine. It's important to note that a retroverted uterus is generally a natural anatomical difference that a woman can be born with, just like being right or left-handed. It is not considered a medical condition or disorder. In some cases, however, it may be caused by conditions such as endometriosis, pelvic inflammatory disease, or fibroids.
Does a retroverted uterus affect the chances of getting pregnant?
This is a common concern among many women. The good news is, for the majority of women, having a retroverted uterus does not affect fertility. The direction of the tilt of the uterus doesn't impact the sperm's ability to reach the egg for fertilization, nor does it hinder the journey of the fertilized egg to the uterus. While a retroverted uterus doesn't generally affect pregnancy, if the tilt is due to other underlying conditions like endometriosis or fibroids, these may have an impact on fertility. In such scenarios, it's the underlying conditions causing fertility issues, not the tilt itself.
Can a retroverted uterus affect pregnancy?
Once pregnancy is achieved, a retroverted uterus usually doesn't cause complications. In early pregnancy, the uterus is small enough that the tilt doesn't impact much. As the pregnancy progresses and the uterus grows, it typically aligns itself into the upward position naturally. In very rare cases, a severely retroverted uterus can cause discomfort or incarceration, where the growing uterus gets wedged into the pelvis. This condition is extremely rare and is often resolved naturally as the pregnancy progresses or can be managed with the help of a healthcare professional. In conclusion, a retroverted uterus is a common variation of uterine position, and for most women, it doesn't affect their ability to conceive or carry a pregnancy to term. If you have concerns about your fertility or pregnancy, it's always best to speak with a healthcare provider who can offer guidance based on your personal health and history. We hope this information has been helpful in your understanding of a retroverted uterus and its impact on pregnancy. Stay informed, stay healthy,